Yeah, I welcome you once again, everyone, to this very important lecture to answer the questions of many people who ask, what is arthritis? Is my neck pain arthritis? Is the pain I'm having at the low back arthritis? Or is it only the pain in my knee that is arthritis? I believe at the end of the lecture today, you'll be able to answer these questions. Now, to define it, arthritis is actually a disease that causes destruction of the joint tissues, and it is actually a progressive destruction, meaning that it starts small and begins to progress. Therefore, if the destruction is not arrested, there's likelihood that it will get to the point where the joint will be deformed. And the initial part of arthritis, as we say, arthritis is two diseases in one. It is made up of inflammatory disease and degenerative disease. At the initial part of the disease, inflammation is predominant. This is the time where the person feels pains, and when you take painkiller or anti-inflammatory drugs or painkillers, as they're generally called, the pain tends to go down. But what happens is that with time, the destruction of the joint tissues like the ligaments and cartilages begins to come in. And it gets to the point when degeneration begins to overtake the inflammation. Two of them will still coexist, but degeneration becomes the predominant disease. And that's when arthritis is fully established. Now, as I said, at the initial stages, you have predominantly inflammation, which will give you these symptoms: pain. If you touch that place, especially a joint that is injured, it might be hot. When it is inflamed, it might be reddish in color. Or those joints that are swollen, there might be some changes in color around that place and loss of function. But as time goes on, all these symptoms will not be associated with progressive destruction of the joints, ligaments, and cartilages and other tissues. Like at the low back, you see when you do the proper investigations like X-ray or MRI, you will see evidence of tissue degeneration. If you can look at this image, the bone, the discs are all smooth. No problem there. But when you come here, you see deformity of the discs and the bone. That is due to the degeneration of the joint tissues. Okay. Now, we have different types of arthritis. In fact, the name arthritis is an umbrella name of more than 100 diseases that can affect the joint. But the commonest ones are the osteoarthritis, the rheumatoid arthritis, the ankylosing spondylitis, the gouty arthritis, pseudoarthritis, juvenile arthritis, fibromyalgia. So these are the things, the diseases that are regarded as arthritis, and there are many more of them: enthesopathy, tendinopathy, facet joint arthropathy. There are many of them which can affect us, sometimes as singly, sometimes in combination. One can have 2 or 3 types of arthritis. Like for those who have rheumatoid arthritis, they have what is called inflammatory disease as well as degenerative disease. When we are going to treat that as a topic, we go into details concerning that. Okay, so what happens in osteoarthritis? There is progressive destruction of the joint tissue, just as I said. If you look at this X-ray or this bone, everything here is smooth. But with time, it begins to crack. And these are what we use in staging the arthritis. So we say osteoarthritis has stage 0 to stage 4, meaning from very mild to very severe. At stage 0, when you do tests like X-ray, the X-ray report will come out and say everything is fine. But the truth of the matter is everything is not fine. X-ray says everything is fine because it did not see any degeneration on the ligament, on the cartilages and bone. But at stage 2, this evidence of destruction will begin to manifest in X-ray and other investigative procedures. So if it's not arrested, it gets to stage 3 and stage 4. And at stage 4, the person will have deformity of such joint. Okay? Now, this rheumatoid arthritis, which is very well known to attack the small joints of the body and causing any deformity. So if it's in the elbow will no longer flex, the elbow will remain like this. If it's in the finger, you see it as it is in this picture. Any joint that it's attacked, it tends to deform that joint. That's rheumatoid arthritis for you. Okay? Now, you have what is called ankylosing spondylitis, which is inflammatory arthritis that affects the spine. So what it does is that it gums the bones of the spine, because the bones of the spine come in pieces, individually separated by the disc. But this time around, you see the bones growing over the disc, uniting each of the bones together, making the back of the person to be rigid, just like this person standing up and cannot move the back anymore. Also in the spine, just as I mentioned, one can have arthritis of the facet joints, what we call the facet joints, like here, where the bones of the back are united in a joint. So such a joint can suffer arthritis, which can contribute to the low back pain many people do suffer. And the one that is, I could call a troublesome one, is fibromyalgia. Fibromyalgia is not a typical arthritis as we know it, but it's the kind of arthritis that affects the whole body, the whole muscles, the whole ligaments, and it does not have specific joint that it affects. Just that the person complains that my whole body is on fire. And this kind of arthritis is majorly most misdiagnosed. And these are the kind of patients the doctor will tell them that their complaints is in their head. There's nothing they can see. Because most times when you run tests, you don't see anything. And some might begin to think that somebody from the village is responsible. So this is the fibromyalgia, which affects the muscles, the nerves, the ligaments, and it is usually very generalized. And sometimes it's seasonal. During rainy season, it tends to be more. During dry season for some people, so it is seasonal. The person will give you a typical symptom history of the thing coming up sometime and less in some other time. Okay, just as I said earlier on, we have known that arthritis is actually two diseases in one, made up of inflammation and the degeneration. Now, in terms of treatment, you now find out that in the early arthritis, when inflammation is predominating, you can use painkillers, rest the joint, exercise, warm or cold pack, and you feel better. Because these are drugs that can overcome the inflammation. But where many of us commit a huge error is to still use this same treatment at this stage when degeneration has become predominant. So you find out that even at this stage, the highest you can or the best you can get with these medications will be momentary relief of the pain for a few days, highest 1 week, if it's up to that, and it will come back again. Because why? These drugs or this treatment or the drugs we take, supplements, everything we take by mouth, do not heal the degeneration. They do not heal the degeneration. So for the degeneration to be taken care of, a treatment specifically meant for it should be given. Okay? So this is just to tell us how anti-inflammatory drugs work. Anti-inflammatory drugs are the drugs we call painkillers. They are called anti-inflammatory because they work against inflammation to make the person feel a bit pain-free. So it's a drug that works through what we call the COX enzymes. They block them and not allowing a chemical that's called arachidonic acid to be produced, which enhances inflammation and all that. So when it blocks it off, the person feels free. But because degeneration is there, which also triggers the production of these things that the drug blocks, so when the drug wears off, the whole chemicals will bounce back again and continue to cause pain. Okay? Beautiful. So if we are going to arrest the arthritis, as I said, the best target of treatment is not the inflammation. You can take drugs for inflammation to feel a bit better, But the best target of treatment should be the degeneration. And to heal the degeneration, you need a treatment that's called regenerative treatment, or you can call it regenerative therapy. They are the same thing. And these are cold laser, PRP, and prednisone treatment. So they are the latest, safest, and most efficient treatment for arthritis and disc degeneration. They heal the root cause of the disease, which I said is the degeneration. They have about 80% chance of the person being permanently healed, especially as long as they start the treatment at the early stages of the arthritis. And what do? They enhance what is called the production of growth factors in your body. And those growth factors will regrow the damaged ligaments and cartilages. And when that is done, they restore the joint back to healthy, normal joint again. So have you been spending money, taking painkillers, supplements, buying every drug that advertised online? If you have not done regenerative therapy, note it that you have not started treating the degeneration, which is the real disease in arthritis. Okay? So, having said this today, I believe your approach towards the treatment of your chronic joint pain will change. See you again. Thank you.